So all right. Well, hello again, everyone. My name is Cara Fernandez. I'm the program director at the Quag Wildlife Refuge, and I am very honored today to introduce Jerry Simmons. He is a clinical assistant professor at Stony Brook School of Health Professions. He graduated from Stony Brook University with a degree in cardiorespiratory sciences and went on to graduate from Weill Cornell Medical College's physician assistant program. He is nationally certified as a physician assistant with commendation in both primary care and surgery. In addition to teaching at Cornell and Stony Brook for over 20 years, he has been practicing as a PA here on the East End since 1995, where he has treated tick-borne diseases of all types. He is an award-winning international medical education lecturer and has developed tick-borne disease educational programs used by physicians and health providers, as well as a published author on Lyme and tick-borne disease. He is a past recipient of the National Award from the Tick-Borne Disease Alliance and is currently conducting a national study through Stony Brook to look at the connection between Lyme disease and fatigue. Jerry has been a member of the medical advisory panel to the Regional Tick-Borne Disease Resource Center since its inception in 2014. And this is a program that we love to host at the refuge because I'm sure all of you know when you're out enjoying the outdoors on Long Island, whether it be on the trails or even in your backyard, we want to learn all of the information to protect ourselves, and Jerry has all of that. So thank you, Jerry, for being here again.
Yes. Well, great, Kara. Thanks for that great intro. And everybody, hopefully you can see the slides and hear me okay. Like she said, we're going to put any questions you have in the chat. That way we'll be able to keep everything organized. So we're going to talk today about all things tick related, a little bit about treatment, a lot about prevention. And as Kara was saying, the Quag Wildlife Refuge hosts this lecture every year through the Tick-Borne Disease Resource Center, which is right down the road in Hampton Bays. But a lot of you out there probably can relate to this statement. One bite can make you sick and change your life. Thomas Mayer from University of Rhode Island mentioned that once, and that statement just really stuck with me. So I bet a lot of you out there, your lives have been completely changed by just one single tick bite. We're going to try to unpack a lot of this as we go along. So as she said, I've been doing things related to Lyme and tick infections for many years. We just started in the town of East Hampton a tick advisory committee where we're working on local tick control, reducing exposure, raising awareness, things like that as well. So I teach at Stony Brook. I currently practice at Morrison Health, which is in Southampton at Hampton's Biomed and in New York as well. And I'm doing a research project I'll show you at the end, researching the connection between fatigue and Lyme disease. And we just recently got approved by the university to do a study on how physical therapists can recognize Lyme disease or not, because many people go to PT with Lyme and they may be the first ones to catch it. So hopefully by next year, we'll have more data on these two big studies that are out there. Just a disclaimer, many things about Lyme and tick bites can be controversial. These opinions are all my own. They don't represent any of these affiliated institutions we talked about. Again, I'm not an entomologist. I am a PA, physician assistant, but I will talk a lot about the different types of ticks and things like that for sure. So you probably didn't study, but we're going to start with a quiz. Now, since it's not in person, you can just shake your head yes or no. But here we go. The first test question. The severe winter we just had in the Northeast will reduce the spring tick population. Everybody remember, in one day in Quag, we had 26 inches of snow. In Montauk, 22 inches, right? Is all of this snow killing the ticks. True or false? Well, I'm here to tell you that this is false, right? That winter weather with all of that snow, unfortunately, did not kill a lot of ticks. In fact, we know that ticks are now a year-round problem. There are definitely pictures of ticks going through the snow. And even look at this, an engorged black-legged tick from Heartland, Vermont, like crawling through the ice. So everybody, ticks are still a year-round problem. But how could this happen, right? How could the snow not kill off the ticks? So it is a myth that a brutal winter kills ticks. And it is a myth that a lot of snow kills ticks. And it is a myth that just being cold kills ticks. The reality, people, is that the ticks that we deal with are cold adapted. And in fact, when we have an inch or two or 24 inches of snow on the ground, that snow insulates the ground and warms it, and moisture is retained. And you might remember that ticks love moisture, right? So you've got this little microclimate under the snow that actually facilitates survival. You add a little bit of leaf litter in there and the soil, and you've got this moist, warm environment where the ticks are just laughing at us all through the winter. This is two new data research that just came out over this. And then when we think about, this whole idea of moisture, right? So ticks survive and love moisture. And ticks are very intolerant of being dried out, right? So I tell people when you've come from the outdoors, raking leaves or walking or hiking or jogging, put your clothes immediately in the dryer. Dry those clothes with dry heat to kill the ticks before you actually wash them, right? Everybody, I am a major fan. I love driving down all the fancy Hamptons roads and looking for nice dry lawns. Dry lawns, ticks do not survive there. I get really angry seeing people watering their grass, besides the water waste, that this is creating a moist environment where there are more ticks, right? Everybody, this year, strive for a dry brown lawn. Don't invite ticks into your yard. Dry your clothes when you've been outside before washing them. And remember, when you see that snowbank, there are ticks hiding under there, right? They like that moist, warm environment under that snow. Now, what about temperature, right? Temperature. Now, the lethal temperature to kill a tick is about 10 degrees Fahrenheit. But some data actually says it can take 2 weeks of 10 degrees Fahrenheit to actually kill the ticks. We had some cold weather in February, but it didn't stay 10 degrees for 2 weeks. Some ticks can even survive to -7, especially some Rocky Mountain related ticks. Everybody, when we get up in the morning, we put the key in the car, we start the ignition, and we all look in our car at the temperature. Everybody, I need you to remember when the temperature is over 34 degrees, ticks are going to be active. In fact, it's March 11th. I've already had several patients call my office reporting that they've either seen ticks, and I've had one person with a tick bite. Everybody, really interesting. This was published about 6 years ago, that ticks, the baby larvae, are actually freeze intolerant. These ticks have proteins in them that act as an antifreeze. And that antifreeze prevents ice from forming in their body. Excuse me. But, excuse me, they do die if they come in contact with ice. So everybody, snow will help ticks to live, but a thick layer of ice or multiple freezing episodes will kill the ticks. So the frost and the ice kill the tick. Another thing, this was just published a few days ago. Look at this data. Every day in spring with temperatures over 40 degrees is associated with a 4 to 10% increase in Lyme disease, right? So ticks are active over 34 degrees, and ticks are more likely to be spreading infection in those warmer spring days. So again, what do we need? People, what do we need to kill ticks? A thick, sustained frost, 10 degrees Fahrenheit. Now, if you're taking notes with a pad, that's great. But if you've got your cell phone, you can click this QR code. I have a whole 10-minute discussion I posted on all of this ticks and surviving and temperature. Plus, Kara just mentioned this will go up on the Quag YouTube page, so you can listen to this over and over and over. Okay, who's ready for our next quiz question? When a tick bites you, they all take a blood meal until they're removed, or like this tick, they become engorged. Everybody, remember when a tick starts turning a grayish color? That typically means that they've been feeding. But when a tick bites you, they all take a blood meal until they're removed by us or engorged. True or false? Everybody, that is also false. We know that adult males typically have minimal or no feeding, and they rarely engorge. They basically will bite you so you can help them travel around and try to find a mate, right? The main objective of a male tick is to mate, and they usually do that on the deer. So it's very important for you to be able to recognize the type of deer that has bit you. If an adult male has bit you, there's a less chance of infection, less need for antibiotic prophylaxis than if a female tick has bitten you. But everybody, I do need you to remember that all female, all larvae, the baby ticks, the nymph, the teen ticks, do feed and become engorged. So it's important for you to know the ticks that are out there, be able to recognize them, and we're going to go over that. We got some slides coming up on that. Okay, here's our next quiz question. Everybody, this is always controversial. Kara told me to not get too controversial in the beginning, but here we go. Here's our quiz. A positive Lyme test is required to be diagnosed with Lyme. A positive Lyme test is required to be diagnosed with Lyme. True or false? Well, I'm here to tell you tonight that this is also false. When you look at the CDC criteria, the CDC does not require a positive test. And in fact, they say that Lyme disease is a clinical diagnosis. Many of you know if you have that characteristic rash, that erythema migrans rash, even if you feel great, with that red ringed rash, you have Lyme disease and you need to take antibiotics. But for many people, 30% of people may just present with the summer flu. Remember, only about 7 out of 10 people with Lyme disease actually get the rash, right? But also, we'll talk about how ticks carry multiple other infections. We may do a blood test for Lyme, but they actually have Babesia, for example. So, it's important to remember that Lyme disease is a clinical diagnosis, right? So I try to teach this to doctors all the time. Someone with an acute summer flu and sweats and aches and pains, think about Lyme disease, right? Don't start doing the blood test too early. Plus, it takes time for that blood test to convert into something positive. So you're right, Jerry. So how do we diagnose? According to the CDC, Lyme disease is diagnosed based on having the signs and symptoms of Lyme, the likelihood that you've had a tick bite. So if you're an accountant in South Dakota and you never leave your office, you're probably not getting a tick bite. But if you live on Long Island, you go to the Quag Wildlife Refuge, you're outside in the Northeast, more likelihood of that, right? The possibility that you've ruled out other things like thyroid and autoimmunity, those different types of things. and blood work only if it's indicated. So, everybody, a really important message. If you've got the classic signs, if you've got symptoms of Lyme disease, which we're going to go over those symptoms, you do not need a positive test to get treatment. In fact, in our area on Long Island, I have a very low threshold for treating someone with all the symptoms. Treating them early is the best way to get positive results. So, what are those early symptoms? Fever, chills, headache, fatigue, right? This sounds like COVID, sounds like the flu, sounds like mono, right? And they may have that classic erythema migrans rash, right? Um, and the rash can look solid red. It can look like a bullseye. It may feel warm, but it's usually not tender, right? And it can appear in any area of the body. People, you heard that right. I could have a tick bite in my armpit and I get an erythema migrans rash on my butt, and I may never be able to see that. Or I get a rash in my hair, I'd never be able to see that, for example, right? So when you think about that rash, it can look many, many different ways. Typically, that early Lyme disease, right, can occur within 3 to 30 days, but those symptoms can linger for months. Stage two, that neurologic, like you've heard of Bell's palsy and numbness and tingling, can occur quickly within a couple of weeks. And late stage Lyme can happen years later. So, everybody, if you're taking notes, you need to have a very high suspicion in our area for Lyme disease. Fever, chills, headache, fatigue, muscle, joint aches. And I tell people, I teach doctors, PAs, and nurses have a very low threshold in Lyme endemic areas. It'd be better to start an antibiotic early to prevent long-term problems. And again, that's controversial, but I've had very good success treating early and aggressive, saving people from long-term problems. Many people on the Zoom are like, Jerry, I'm here because I have all of these different types of symptoms, and nobody seems to know what I am. That's why we're here. We're going to try to help you out and figure that out. So, what about doing these blood testings, right? There are Lyme blood testings out there. The old way is what's called the ELISA, the enzyme-linked immunosorbent assay. It basically gives you a number scale looking at that immune system response. And then we would follow that up with what's called a Western blot. IgM, like Mary, is the active infection. I think IgM means miserable. And IgG is that older chronic type marker. The Stony Brook University lab for Lyme disease, this is a screenshot of one of their results. I've had very good results using the Stony Brook lab. It's covered by insurance, and they do a pretty thorough job that way. But everybody, it is 2026, and we're getting away from the old-fashioned ELISA and doing something called the VLSE peptide. VLSE is the surface protein that's on the outside of the Lyme germ. Again, they show it to you on a number scale, right? Over 0.91. This person has 1.14. Then we would follow it up with the IgM active marker, IgG older marker, right? When you do the VLSE and the Western blot, we call that the modified two-tiered testing. Now, when we look at this way, right, basically the ELISA and the Western blot, that's called the two-tier test. Modified is with the VLSE. Even better than VLSE, we can take, even better than the VLSE, we can take part of that VLSE and do what's called a C6 peptide, which is very specifically located on the surface of Borrelia burgdorferi, the Lyme germ. This C6 peptide is very specific at triggering the immune system to produce antibodies. And this is very highly conserved, and the C6 can last for a long time, even after treatment, right? There is some newer data that shows the C6 may be the more accurate test in early Lyme disease. So any of you working in urgent care or people in the ER, we're finding that we're doing a C6 ELISA because a C6 positive usually indicates that there's some kind of infection going on there. Now, everybody, really interesting. This was a study that just came out a few weeks ago looking at the difference between male and female patient immune responses. And everybody, they found that men had a higher odd of an antibody test in Lyme disease. And postmenopausal women also had a higher antibody positivity than women who are still actively menstruating, right? So we could do a whole lecture just on this type of thing, but there is data published that shows that women, their immune response may not react as quickly as men. So men may be getting a more positive test and quicker treatment. So, all of you women out there dealing with these symptoms, right, think about this. If you have a Lyme test that's negative, it could certainly be related to hormonal and immunologic changes. And again, I could talk for an hour just on this particular thing here. Wow. Everybody, what an opening. Really exciting. We talked about cold, we talked about frost, we talked about how to diagnose Lyme, we talked about male female differences, the different types of testing. But I just want to make sure that everybody knows what we're talking about. We're talking about Lyme disease, and we're going to talk about some of the different co-infections. Everybody, please, Kara will tell you I go off of my rocker. Please remember, it's not Lyme's with an S. It's just Lyme disease. There's no plural, right? Lyme is the most common tick-borne disease. It's caused by a bacteria, and there are many variations of the Lyme germ. You know that. Some people with Lyme have headache. Some people have facial weakness. Some have joint swelling. And the Lyme germ specifically looks like these little spirochetes, right? That kind of drill all around through the body. Everybody, I know that there are Pepsi drinkers out there, Coke drinkers, Democrats, Republicans, Mets, Yankees. There's a lot of controversial stuff out there, but really controversial in the medical world. Everybody, you listening? You know what's really controversial? What is Lyme disease? We can't agree on a definition. What is Lyme disease, right? Now, the Center for Disease Control says Lyme disease is caused by the bacteria Borrelia burgdorferi. That's the name of the Lyme germ, right? But we know medically that there are many different types of Borrelia, right? In fact, Mayo Clinic says Lyme disease can be formed by any type of bacteria, Borrelia bacteria. Borrelia burgdorferi, Mayoni, Abseliae, and Garnii, right? So when you look back at the Lyme disease testing, we're testing mainly for Borrelia burgdorferi. But we do know that Mayoni, Abseliae, Garnii, these other Borrelia are out there. So you may have Lyme disease, and we're just not checking for the right type of Borrelia. So there are many different types of Borrelia that are out there, but we're primarily checking for Borrelia burgdorferi. Now, my favorite definition of Lyme disease came from an article published from Stony Brook with Yang and Dr. Luft, who's in our tick committee, right? And they define Lyme as a multi-system tick-borne disease. Multi-system. So if someone comes to me, Jerry, I have a headache, it must be Lyme disease. Or somebody comes to me, Jerry, my shoulder hurts, it must be Lyme disease. I'm like, no, I don't think so. But if somebody comes to me, I have a headache and I have shoulder pain, or I have fatigue and knee pain, multiple systems are involved, that's much more likely to be related to Lyme disease. Obviously, the exception to this rule is if you have the erythema migrans or rash, that's Lyme disease, right? It's caused by the slowly dividing spirochete, Borrelia burgdorferi, right? This is why you need 3 or 4 weeks of antibiotics or more, because the strep infection replicates in hours, and 5 days for a strep infection is plenty. But the Borrelia germ takes so long to divide, you need a longer amount of antibiotic. Everybody, look at this published data. The organism can evade host immunity. So, what that means is if we're doing a blood test looking at your immune response, the organism can hide from that immune response. And it can persist as a latent infection, only to reproduce, giving rise to chronic disease. So that person, when you're in the post office and the person's like, oh, my Lyme disease of 3 years. I'm like, oh, actually, I saw a published article that said that that could go on for like 3 years. You know what I mean? So really interesting. It is important to remember that no two Lyme cases are alike. And the Infectious Disease Society of America, the main group of infectious disease doctors, describes the Lyme spirochete as versatile and adaptable. And Lyme invades immunologically privileged sites, meaning the joints and the nervous system, where there's less vigorous immune response than in the blood. So, everybody, another reason why your Lyme test may be negative is you might have the infection in the joint or the nervous system, not in the blood, right? And they go on to document that 60% of untreated patients or inadequately treated patients can progress to disseminated disease. That stage 2 or stage 3 disease that we talked about, where it affects the joints and the nervous system, cardiac, even affecting the skin, things like that. Really interesting. This just came out a few weeks ago. The Health and Hospital Corp and Health and Human Services, sorry, came out with a new definition of Lyme disease. And they define Lyme disease as a tick-borne infection that can lead to chronic and often invisible multi-system illnesses. And even after being treated for Lyme disease, 20% of patients may develop, everybody, here's a new term on a Wednesday night, something called IACC, infection associated chronic conditions. Meaning you have an infection and you have symptoms after, like lingering symptoms, we say you have IACC. This could be fatigue, cognitive issues, neurologic, and other long-term health challenges. And that'd be really interesting. The Center for Medicare Services updated their chronic care management protocols to include Lyme disease, allowing patients with long-term Lyme symptoms to get more expanded care. I bet some of you out there in the room are thinking you might have IACC, this infection associated chronic condition. So the National Academy of Sciences was actually charged with studying this, right? This idea of infection associated chronic illness, specifically the Lyme infection associated chronic illness, and how that overlaps with post treatment Lyme disease syndrome. Everybody, if you've got your phone, you can scan or you look at the video later. This QR code brings you to this amazing report. And this is not a political report. This is a nonprofit science group, right? Which was charged with identifying issues with IACI, looking at these longer term effects after infection. So we're talking about IACI and a version of post-treatment Lyme syndrome. Last slide about Lyme disease. One of my favorite slides of all, people. Get excited. The medical textbook, Harrison's Principles of Internal Medicine, which we all read in PA school and medical school, talks about the Lyme germ, Borrelia burgdorferi, as surviving in a microaerophilic bacterium. What does that mean? Lyme hides from oxygen. It gets into the cartilage and the fascia, the deeper tissues. It likes to get out of the bloodstream into the tissue. The genome is very small, like it can fit in very small little places. It has a very unusual chromosome. And the most remarkable aspect of Borrelia burgdorferi is there are sequences for more than 100 known or predicted lipoproteins. So, everybody, what does this mean according to the textbook? There can be many different types of Lyme disease. Some cause headaches, some cause rash, some cause joint pain, on and on and on and on that way. So many people can have multiple overlapping infections. For example, neurologic Lyme could be different from arthritic Lyme, or fatigue versus rashes, for example. Everybody, many times a patient has come to me, they're like, Jerry, my symptoms are not clearing up. Doxycycline is not helping me. I'm like, wow, according to the textbook, there are many different versions of Lyme. Maybe doxycycline does not work for your version of Lyme disease. I put that patient on amoxicillin or penicillin, and boom, everything starts falling into line really, really quickly. So, everybody, if you've been dealing with these symptoms, you're on doxycycline, it's not helping, you may need to switch to a different drug. At least that's what this textbook is telling us. The other interesting thing the textbook says is the spirochete has very few proteins with biosynthetic activity. What does that mean? That the Lyme germ in your body depends on your nutrition to survive. When you eat, you're feeding the Lyme germ. When you eat, you're feeding the Lyme germ. In fact, in a really revolutionary study, they published that certain components, minerals and metals, like copper, zinc, and really important manganese, actually feed the Lyme germ. So, everybody, when someone comes to me with Lyme disease, whether it's a rash or they've been sick for years, I'm like, get rid of your multivitamin. Don't talk to me until you've gotten rid of your multivitamin. Because the zinc, copper, and manganese, not magnesium, manganese can actually be feeding the germ. And everybody, really remarkable, Stanford University did a study that found that the allergy pill, Claritin, or loratadine, or Zyrtec, those antihistamines, can block manganese and in part starve the Lyme disease germ. So, everybody, this summer when you're at a barbecue and a patient's like, oh, excuse me, I have to take Claritin for Lyme disease. You're like, oh, Stanford published on that. That's like a real thing, right? So, everybody, think about that. If you're dealing with Lyme disease out there, don't feed the germ, right? Copper, manganese, zinc, things like that. So, as we said, early Lyme disease, you get a rash. Weeks to months later, we're talking 20% of people, they can develop this neuroborreliosis. All of a sudden, they get Bell's palsy, headache, cranial neuritis, like really bad nerve pain. And then months to even years later, they can get the arthritic type symptoms, right? Everybody, just an interesting fact. We already know that there are many different kind of Lyme germs. If you visit Europe and get a tick bite, the Lyme disease in Europe has a very early preponderance to get into the lymphatic system. People with European Lyme get swollen lymph nodes, and then it can progress to the heart and later to the skin. In fact, one of the classic giveaways that we teach doctors and PAs and nurses is that European Lyme disease has an affinity for the nipple, right? And I had one patient come to me, with like not feeling good with the flu, and I'm doing his physical exam, and I press on his nipple, and wow, he's like, that really, really hurts. I'm like, wow, your nipples hurt when I touch them? And I'm like, have you been traveling? He's like, oh yeah, I spent 6 weeks in Europe. I'm like, oh, give that person with nipple pain doxycycline. And everybody, this is not Jerry blowing hot air. This is published data from Nature magazine. Really interesting. Wow. So we're going to go over a couple of stories and then we'll talk about how to keep ticks away from you. Because I know, like me, you're all anxious to get back to the wildlife refuge, but you want to do it safely. Okay, here's a few stories. The first case I saw, a 19-year-old had a rash, a red ringed rash, that he noticed when he was changing his shirt. He feels absolutely fine. He was a week ago camping in Smith Point Park. He had a couple days of the flu and aches that went away. This kid came in with a rash and he had a couple days of feeling fluish. I gave him doxycycline. The rash went away. I said, come back in a month. And he feels absolutely fine. End of story. I haven't seen him since. Look at this. In Greenport, a landscaper working in the summer who's also a healthy triathlete, boom, suddenly passes out, right? Now, is it dehydration? Is it being out? Is it, heat exhaustion, heat stroke? What's going on with this guy? But an EKG reveals that he has a pulse of 30. He's breathing, but he gets to the ER unconscious. A healthy triathlete landscaper suddenly collapses. He was admitted for 2 days and given 3 weeks of IV ceftriaxone by a PICC line. And this is a classic example of cardiac Lyme disease. In fact, we know that Lyme disease can affect both the heart muscle and the heart's electrical system, interfering with how the heart beats, as well as the muscle function. And we're supposed to now, according to the new CDC protocol, ask all patients with Lyme about cardiac symptoms. Anybody with Lyme, screen them for cardiac symptoms. And everybody, look at this CDC directive. Ask patients with acute, unexplained cardiac symptoms about tick exposure and any other symptoms of Lyme disease. So screen patients for Lyme if they present with cardiac symptoms and treat patients with suspected Lyme with antibiotics immediately. Okay, let's hear a third story. Everybody loves a good story on a Wednesday night, right? Here's a 40-year-old healthy male who was flu-like for about 2 days, sore throat, fever, malaise. He had a big time headache. He doesn't take medicine. He has no pets. He doesn't have smoker. He's not a smoker or alcohol. He was seen by his internal medicine doc who said he had the flu and told him to just drink a lot of fluids. But still, 4 days later, this guy's flu is not getting better. He goes now to the ER with these symptoms: fever, weakness, fatigue, muscle aches. His blood work's normal. PE, his physical exam is normal, but his temperature's up by a little. And he was sent home with the flu. And everybody, you already know what happens. 10 days after that, he comes to me with flu, now a 14-day flu, and he wakes up and all of a sudden the left side of his face is all completely weak. The forehead is flat, he's drooling, and this guy has Bell's palsy, neurologic Lyme disease. This guy reminds me of why I give doxycycline early to people with the flu in high risk areas. It'd be better to overtreat a little with doxycycline, especially in our area, than to deal with this later on. Again, my opinion, that's controversial, but that's just the way that I like to do things. Wow. Okay, we'll get in one more story. So here's a 33-year-old, right? Two more stories probably. She had a low-grade fever, myalgia, aches and pains, headache and neck stiffness, headache, fatigue, and 4 or 5 weeks earlier, she was hiking in Montauk, and we thought, is this Lyme disease? Is this Ehrlichia? She was given doxycycline. We actually found she did not have Lyme disease. She did not have Borrelia burgdorferi. She actually had a condition called Borrelia miyamotoi. Borrelia miyamotoi is more common here on Long Island, and this used to be called tick-borne relapsing fever or relapsing fever, Borrelia miyamotoi. And again, when someone comes in acutely sick, do a C6 peptide, look for Borrelia miyamotoi. Really interesting. Borrelia miyamotoi is carried in the deer tick, the black-legged tick. And look at this data from about 10 years ago. They found that Borrelia miyamotoi is in Ixodes ticks, right? And Ixodes ticks also can carry viruses, anaplasma, and babesia. And everybody focus on this. Look at this published data. In Ixodes ticks, there are numerous other microorganisms with unknown pathogenic potential. What are they saying? There may be other germs in the tick that we haven't even figured out yet. Really interesting. So maybe when Kara and I do this a year from now, we're going to find that there are other new diseases, and that explains why some people aren't getting better. Borrelia miyamotoi, I also want to point out, transmits in less than 24 hours. Um, Most of you know, like, oh, the tick has to be off within 24 hours, but Borrelia miyamotoi has a much shorter transmission time. Everybody, as soon as you get bitten by a tick, as soon as you see it, take it off immediately. Don't wait until you get home, right? And we know that Borrelia miyamotoi can be transmitted from an adult female into its eggs. So sometimes larvae may actually have Borrelia miyamotoi. Get those ticks off. As soon as you get a bite, get those ticks off. Now, here's our last story, a 38-year-old active mom who's an accountant and a hiker, right? In 2022, she had this dramatic flu-like illness after visiting Montauk. Her joints swelled for 2 weeks and then they resolved. She probably was just like, oh, I was just like probably working too hard. She quit hiking and stuck to the gym. In 2023, she developed shooting pains and joint pain, easy exhaustion, and memory problems. Everybody, a quick tip, shooting pain, especially at night, is classic for longer term Lyme, and joint pain that travels around. It's your neck, then your shoulder, then your knee, then your hip is another great example of classic Lyme disease presentation. So she saw her family practice PA, couldn't find anything. She even saw a psychiatrist and a rheumatologist. And like, listen, lady, you're fine. You have shooting pain, joint pain, you're tired, you have memory problems, but I think you're fine, right? Lo and behold, she gets a really bad case of bronchitis, and she's given an antibiotic, Ceftin, which is a cephalosporin, which is related to IV ceftriaxone. Everybody, are you listening? This lady with these chronic problems is given Ceftin for bronchitis, and all of a sudden, her joint pain gets worse. Her joints start to swell. She has shooting pain. She needs 4-hour naps. So the antibiotic for her lung is making all of her other symptoms worse. Everybody, this is a well-known phenomena called a Herxheimer reaction or a Jarisch-Herxheimer reaction, which is where when you kill the spirochetal bacteria, it releases these endotoxins, things called interleukins and tumor necrosis factor, which triggers an uptick in these different types of symptoms. So everybody, if you're hearing me, many patients with Lyme disease may feel worse before they feel better. And this is, again, not Jerry blowing hot air. There's actually a medical text we use called Up to Date, which has a pretty impressive feature on this Herxheimer reaction. This is seen in Lyme disease and seen in syphilis. So, everybody, when I do this lecture for veterinarians and PAs and doctors and nurses, the first thing I tell them, you do not need a positive test to have Lyme disease. Look at the symptoms. And the second big thing I tell them is patients may get worse before they feel better. And stopping that drug too early may lead to antibiotic resistance. In fact, it was about 2 or 3 weeks ago, a patient called me and like, Jerry, you're bad. You gave me a medicine and I'm feeling worse, not better. Like you're feeling worse, right? That could definitely be related to this Herxheimer reaction. Again, you have to check for, other conditions. Could it be related to COVID or the flu or liver stress? But classically, when all of their symptoms get worse, we think of this Herxheimer reaction. Keep on killing the germ. Don't stop the drug. So in women like this, they may continue to have symptoms long term, right? And back in 2023, they published a study looking at bacterial load in patients with chronic fatigue syndrome. I know. I apologize. I apologize. Chronic fatigue syndrome is an antiquated term and politically incorrect. You're only supposed to say myalgic encephalomyelitis, which is the new term for chronic fatigue. This study was followed up just a month ago. This was published by North Carolina State University. They took patients with myalgic encephalomyelitis, chronic fatigue, they drew their blood. And even though it was a small study, they found that 50% of people with myalgic encephalomyelitis, chronic fatigue, had Bartonella or had Babesia. So those of you out there dealing with long-term fatigue, think about some of this stuff. Look at the slides again later on, right? And present your case the next time you go to your medical visit. Great. So we're going to get into the quag stuff, the prevention and what kind of ticks are out there, everything like that. So back in 2011, you can see that most ticks, right, in the Wisconsin, a little bit in Michigan, upper Illinois kind of area, and of course a lot in the Northeast, right? If you look right here where the Quag Wildlife Refuge is, we are in the epicenter of Lyme and ticks. Our climate, the moisture, the heat, the cold in the winter, like we're in an ideal climate for tick bites and ticks to grow. Everybody, look at this. And now look in 2023. Look at the amount of spread of Lyme disease. We're talking, obviously, warmer climates, warmer earlier springs, later warmer falls, deforestation, migration. You know the story. Now, Lyme disease has been reported in all 50 states. Now, am I telling you that in South Dakota, like, is there Lyme disease there? There's some data that says that, but most likely these are people that were vacationing in the Northeast, and then weeks later they developed infection in the and then they were reported in South Dakota. There's a lot of Lyme disease in the panhandle of Florida to the point where there's actually a Northeast Florida Lyme disease association now. And everybody, not to scare you too much, but it seems that ticks with infection seem to migrate faster than ticks that are not infected. I have a whole nother lecture on that, but that's a really interesting fact. And again, the Lyme does not stop at the border here. Lyme disease has been slowly invading Canada already. I know you're like, Jerry, the Canadians really don't like us right now. Like they think Lyme disease ticks are coming from us north. That just adds to the problem. Everybody, this is an older article, but they figured out back in 2012 that the warmer climate is pushing Lyme disease 4 kilometers deeper into Canada every year. Every year, there are towns in Canada dealing with Lyme disease that they've never seen it before. And with climate change, people are finding ticks where they never used to, right? So, mosquitoes and ticks, vector diseases are an epidemic related to these climate changes. Everybody, in fact, listen to this story. Lyme disease has become such a big deal in Canada. I believe that in the Canadian Parliament, someone said, we need to save the lives of Canadians from Lyme disease and tick bites. What can we do? And they're like, we should pass a law to give every Canadian doxycycline. Like, well, we really can't do that. But in Nova Scotia, they passed a law giving pharmacists prescribing privileges for doxycycline because of the epidemic of Lyme in Nova Scotia. Everybody, according to this data just from last year, um, of all the doxycycline given in Nova Scotia, 61% was by pharmacists. That's how big of a deal Lyme disease is in Canada. Wow, think about that. Now, even though we spent a lot of time talking about Lyme disease, we have to worry about things like Rocky Mountain spotted fever, anaplasma, Ehrlichia, Babesia. And you look on this map, you can see we're covered in everything, especially Babesia. There's a lot of relapsing fever, Miyamotoi on the West Coast, and anaplasma, right, in that, Wisconsin, Illinois, Michigan type of area that way. Now, look at this really interesting study from the Society for Microbiology. They looked at ticks and they took samples of ticks and found that one tick can have multiple kinds of Lyme and multiple other different types of bacteria, right? In fact, an adult tick can have Borrelia burgdorferi, Borrelia miyamotoi, we're talking about the deer tick, anaplasma, babesia, and the virus, Powassan virus. So you're right, people. You can see multiple infections from one tick. Someone takes amoxicillin, they don't get better, give them doxycycline. And on our website, you can get a PDF of our guidebook where we talk about this problem specifically, where you can get multiple infections from one tick. Almost all of you know someone who's had babesia. This is a parasite like malaria, right? It's spread by black-legged deer ticks. Symptoms include fever, chills, sweat, fatigue, and it can cause pretty significant anemia. You get this Maltese cross shape when you look at a blood smear. Patients need to take antibiotics and antiparasitics. And from 2011 to 2019, cases of babesia in the Northeast literally doubled. And everybody, another Stony Brook person on our team, Dr. Marcos, published a study on this increasing rate of babesia, right? And the Infectious Disease Society of America recommends at least 6 weeks of antimicrobial treatment for patients who are immunocompromised. 6 weeks of antimicrobial, meaning an antiparasite and an antibiotic, right? And what he published is cases have relapsed even after weeks of treatment. So, everybody, this idea that you can be treated for an infection, you get a quiet spell, and it can relapse. I've shown you multiple articles that show that that is the thing. What about anaplasma, right? Anaplasma, these patients are sick. Fever, headache, fatigue, bad looking blood counts. Um, and it is a bacteria. It takes a week or two to develop anaplasma. Ehrlichia. Everybody, we teach doctors, PAs, nurses, when someone has Ehrlichia, they typically come in looking sick. Muscle aches, vomiting, fever, headaches. You look at their blood count, low white blood cells, low platelets, very high liver function. Um, they have a very funny looking leukocyte, right? A morula, a polymorphonuclear leukocyte. Giving these people antibiotics is typically a quick resolution. Wow. What about the viral infection, right? So Babesia is a parasite. Lyme and Ehrlichia are a bacteria. Powassan is actually a viral infection, and this tends to go right to the nervous system. Fever, headache, vomiting, weakness, these are all neurologic symptoms, right? And we've had several cases now in Suffolk County. Last year, the Suffolk County Health Department put out a post warning people about Powassan. Luckily, there are not that many cases, and many people may get Powassan and never have really big symptoms. But about half of people will have permanent neurologic changes. Everybody, if you're taking notes, Powassan virus has a very fast transmission time, 10 or 15 minutes. Well, that's true. Get the ticks off as quick as you can. What about that famous one, alpha gal, right? People, I see you shaking your head, right? Everybody knows someone that can't eat meat, right? And you get that from a Lone Star tick bite. It introduces an alpha gal carbohydrate and triggers an immune response, right? And basically makes you unable to process mammalian meat. It could be a steak, a hamburger, a piece of pork, a lamb chop, a marshmallow, medicine that is made, with some of those collagen type components. Doctors, nurses, PAs, or curious non-medical people, there's an amazing free training on recognizing alpha-gal. Again, take your phone and click that QR code or look at the replay later. Everybody, everybody needs to be familiar with alpha-gal. It's a big deal in the Northeast. Okay, let's talk about the ticks, prevention, couple more things on testing, and then we'll wrap it up. Okay, so mainly here in the Northeast, we're dealing with the dog tick, the Lone Star tick, and the black-legged deer tick, right? The dog tick is basically active, end of February right through basically till Labor Day. There are dog ticks out there right now. The Lone Star tick, we're seeing adult Lone Stars now starting in March. The larvae tend to come out in the fall. People call them chiggers, but they're really not chiggers, right? They're larval Lone Stars. And the nymphs are in the middle. Remember, Lone Star is what gives you alpha gal, right? And then the black-legged tick, the adults are fall right until basically Memorial Day weekend. The nymphs are out in the summer. Those are the aggressive feeders. And then you've got larvae basically end of spring, deep into the fall. So basically all year round, we're dealing with one of these kind of ticks, right? Everybody, very important for you to know your ticks, right? The baby ticks are the larva, the newborn. They each have three legs on each side. They may have Borrelia miyamotoi, but most larvae are going to be harmless. If someone has a larval tick bite, I don't get too excited about it. Nymphs and adults have eight legs altogether. People, nymphs are aggressive teenagers. They're hungry, aggressive feeders, right? So make sure you're able to count the legs on the tick if you're able to pull it off, right? Now, when we think about the deer tick specifically, it's got that orangey back, those black legs. Again, larval, nymph, and adult male. I'd encourage you all to try to get one of our Southampton Hospital tick removal kits, which has the little forceps in it, a tick guide, and a magnifying glass. This is the best way, especially for larval and nymphs. We found that those little tick spoons tend to tear the ticks more than being able to get them out completely. It also has this really cool card for you to carry with you that tells you all about what kind of infection is happening where, right? So we think about Lyme disease, Borrelia miyamotoi, Anaplasma, Babesia, Powassan virus. Interesting, they did a study of kids with Lyme disease, and very few of them remembered actually having a tick. If you have a tiny, tiny, tiny little tick the size of a head of a pin, if it's in your hair, behind your knee, in your butt crack, how are you ever going to know, right? Dog ticks are not harmless. They could have rickettsia, Rocky Mountain spotted fever, and tularemia. Everybody, the good news for you is larval and dog ticks typically go after mice. We very rarely are going to see a nymphal dog tick on a person. Don't forget that. The Lone Star tick, of course, is the one that gives you the meat allergy, but also it can give you Ehrlichia and what's called Southern Tick Associated Rash Illness. The Lone Star bites you, you get a red ringed rash, and it looks like Lyme disease. We're going to give you doxycycline, but it's not really related to that. These nymphs are aggressive feeders. Now, everybody, this is what gives you alpha gal, right? And my own personal theory, it is not scientific, but I tell patients when you have a lone star tick, especially a female, which is a feeder, or the nymph, do not eat meat for a month after a Lone Star tick bite. And there may be a chance that you do not trigger that alpha gal reaction. Just a theory. I've got several hundred people in my data bank. It does seem like there might be something to it, but again, not scientifically published. Everybody, it's a free treatment. Don't eat meat for a month after a Lone Star tick bite. The next tick that's out there is the Asian longhorn tick. These are ticks we're finding in Suffolk County. They prefer animals over humans. If you ever find one of these, we want to study it. Save it and email us for info on how we could pick it up, right? We need your Asian longhorn ticks to study, right? The Entomology Society has determined that there can be Lyme disease in this Asian longhorn tick. But again, it generally goes after animals. People find these on their long-haired dogs a lot. Great. Okay, we're going to talk about prevention specifically now. So, how do ticks get infected? Ticks are going to be infected by biting or feeding on an animal that has Lyme disease, like a bird, like deer, like the white-footed mouse. And then once that tick gets infected, it passes it on to another animal or to a human. Everybody, we know that the white-footed mouse carries the ticks that have infection. But the deer is where the mating actually happens. The male and the female get together. So one tick could have hundreds or thousands of babies over its lifetime. I'm a big fan of that four poster system where you've got these little pool noodles coated with permethrin, and that helps to kill off a lot of the ticks that are carried by the deer. Again, that's a controversial system. We could talk more about that another time, but I think that four posters reduce the amount of ticks. Doesn't reduce the deer population and car crashes and them eating your vegetables, but it does reduce the amount of infection. Everybody, when you look at the typical life cycle, the babies are typically born and the eggs are typically um, hatched in the spring. They will basically molt into larvae, and that larvae must have a mouse, a bird, or a chipmunk to feed off of, where it will then in the fall molt into the hungry teenager. These are the ones coming after you, right? And it'll kind of be dormant winter, wake up in spring, where that nymph needs a second meal to then develop into the adult, and then even possibly that third meal. So, everybody, if we can reduce the mouse, bird, and chipmunks in our yard, that is going to kind of stop this whole cycle at the very, very beginning. Now, number one, what do we do if you do get a tick bite? Use a fine tipped forceps like the ones you can get from our tick center. Don't use a match, don't use oil, don't use glue. Like clean it with alcohol and bacitracin. And everybody, one of my favorite things is good old-fashioned World War I iodine. You put Lugol's iodine on a tick bite, it kills all of the germs. It is amazingly good for the itch. Just be careful, iodine can stain your clothing. Also, everybody, next time you're shopping online, pick up one of these $20 200x magnifying glasses that click right onto your phone. And they can zoom in and you can see super fine detail of all of these ticks. Wow. Knowing your tick is going to tell you what disease and the chance of infection. What about this? Should you test your tick? I generally do not have people test ticks as long as I know what the tick is. Because everybody, if the tick is slightly engorged, there's a chance that the infection is in you, and then the tick may actually be negative. If you test your tick and it's positive, then maybe you didn't get the infection at all. If you test the tick and it's negative, maybe all the infection is inside of your body. So that's why we use all of these other types of criteria. People, get to really know your ticks. Remember that the erythema migrans Lyme rash is typically occurring over days. It gets to be 5 centimeters or bigger. A tick bite reaction is itchy. Most erythema migrans are not itchy. The tick bite reaction will typically clear very quickly, and that iodine, liquid iodine, is really good for a tick bite reaction. It gets rid of that bump and that itch. So, guys, now that you're all completely scared of ticks, how are we going to prevent this? Preventing tick bites is a multi-level approach. Obviously, situational awareness, right? Not walking through tall grasses, not walking over wet grass. People, we're all adults here. Use common sense, right? Protect your yard, your skin, your clothing, your shoes. Work with a community, like with a four-poster system and deer control. And as we said, when you come inside, remove your clothing, put it in the dryer first. Run a lint roller over you. And the lint roller is also great for pets to kind of catch any loose ticks that might not have bitten yet. And then take a shower. And checking with the back of your hand is a much easier way to feel for ticks that way. Everybody, I regret to inform you, this is the dark part of the talk where I have to ask you to please get rid of your bird bath. Please get rid of your bird feeder. Bird baths, these ticks, you could have 50 ticks on a robin, right? And a bird feeder is dropping bird food onto the ground, which is attracting chipmunks and squirrels and mice, and they're bringing more ticks into your yard. Everybody, how do you think people in Central Park who never leave Manhattan get Lyme disease? As the birds migrate, they stop in Central Park and they're dropping ticks there, right? Keep compost elevated or use one of those circular bins. Control leaf piles. Use deer and tick bait boxes. Ticks will not usually crawl over a wood chip border. Like put a 3-foot wood chip border around your yard or around your deck or play areas. Remember, wet grass is bad. Brown, dry grass is good. And consider having your yard sprayed, right? For example, like cedar oil is an excellent spray for the yard. Everybody, protect yourself on the skin. My favorite is Cutter lemon eucalyptus on the skin. For clothing is Sawyer's permethrin or permethrin. Tuck your socks into your pants. Everybody have 2 layers of protection on your skin and your clothing. They did a study that if you're feeling kind of lazy, you want to go to the quag reserve, but you're feeling kind of lazy, if you just treat your shoes and your socks, you're 73 times less likely to be bitten by a tick. So keep that permethrin sprayed on your shoes and socks. Always tuck your pants into your socks. Maybe use some sticky duct tape, anything that's going to create a barrier, preventing them getting into you. Long sleeve shirts and everything like that. Duct tape in reverse, the sticky side out, is a classic. Once you're out there, remember ticks are not flying to get you. They typically hang out on a blade of grass. Like both of these people in this picture are going to be in trouble. I'd say go to the beach, not in the dunes. Like go to the beach, avoid the trails during peak season. Wear light clothing and keep that repellent on. Be smart, situational awareness, right? So, everybody, I'm a big fan of Cutter eucalyptus. If you like to support local small companies, the Three Moms Organic from East Hampton makes an incredibly potent product. It's all natural, skin and clothing. Many of you remember your grandmother used to say lavender keeps ticks away. It's actually true. Lavender soap, shampoo, dryer sheets, and again, a little bit of permethrin, especially shoes, sock, and clothing. This slide is the winner. They did a study specifically on mosquitoes, comparing DEET with other agents. And everybody, look at this. Oil of lemon eucalyptus after 4 hours actually worked better than the chemical DEET. Wow. The Environmental Working Group, which is a group that I've worked with, very open. They work with Sierra Club and everything like that. Environmental Working Group. They actually say we'd much rather have you use a chemical spray temporarily than risk getting a tick bite. So, Environmental Working Group actually says use DEET, picarton for protection. They give a very high rating to oil of lemon eucalyptus, which is really good news. Okay, we're almost done. Can you stand with me for a few more slides, right? So, what about if you do end up getting Lyme? What is the treatment going to be? As we said, the treatment is typically going to be doxycycline or amoxicillin for at least 2 weeks, sometimes more. We can give kids doxycycline as well. Many people, though, are becoming resistant to doxycycline. There's a new member of the doxycycline family called omandacycline or Nuzyra, which in unpublished early experience is getting a pretty good traction in getting rid of Lyme disease. So you may see more and more PAs and doctors writing for omandacycline over doxycycline. For neurologic Lyme, we're typically thinking more um, doxycycline, even IV antibiotics. This is specifically for facial palsy. We're thinking 3 weeks of treatment. For neurological Lyme disease, Johns Hopkins has been doing brain imaging. They've actually found that patients with post-treatment Lyme, their brains look different from healthy controls. So in patients with long-term symptoms, there
Could I
may
have a hot
be
fudge
something.
sundae, please? And that's all.
And a couple more slides, right? Neuroborreliosis, right? Which is that neurologic Lyme disease. They just did a study in 2023 looking at interferon and inflammatory markers. And they found that in patients with long-term neurologic Lyme with lingering symptoms, that they can find up to 20 different immune mediators that are abnormal. So, for all of you out there with long term symptoms, neurologic long term symptoms, and brain fog, there is this newer, exciting testing that is coming out. I do just want to point out that we talked about all kinds of Lyme disease, but Lyme disease may also go right to the brain and cause psychiatric symptoms. Everybody, I know you're tired. We're well over the hour, but focus on this slide, please, for a minute. Lyme disease can cause psychiatric symptoms, right? In fact, in a published study from Columbia University, Dr. Brian Fallon found that the incidence of any mental disorder in patients with Lyme disease, they have 1.3 more psychiatric disorders, 1.5 more affective disorder. Lyme disease patients have double suicide attempt and almost double successful suicide. Everybody, I've asked you to remember a lot, but really important. If you have that grandkid, that neighbor, that husband, that wife, son, daughter, coworker, who's always a solid person, and all of a sudden they start getting depressed. They start getting OCD and twitchy and really sad and crying, or they've developed a new anxiousness or worry. At least think about that this could be one manifestation of Lyme disease. And I asked Dr. Fallon, I'm like, Dr. Fallon, how should I believe this? You're telling me that Lyme disease gives you new psychiatric symptoms? He's like, of course. Now, in medicine, in science, when we look at a study, we look at what's called the N, the number of people studied. Everybody, listen to this. In this Lyme psychiatric study, look at the number. There were 6,945,837 people studied. Everybody, be on the alert. In fact, I had a grandma email me last year, like, Jerry, I went to your talk and I picked up that my grandson started acting strange, locking himself in his room, being really anxious and nervous and twitchy, and then really getting into a deep, dark state. And she demanded that he get worked up and treated for Lyme disease. And she's like, I think I saved his life by pointing this out. Everybody, remember this data. I am currently wrapping up a study right now at Stony Brook, Southampton, where we're looking at the association between Lyme disease and fatigue. And early data is showing that there definitely is a connection there. So when we do this next year, hopefully we'll have this published. So everybody, we made it, we made it, we made it. In summary, right? Your job is to help us get the word out, right? Teach everybody to prevent tick bites and to be careful out there. If you're interested in one of these tick kits, there's a QR code where you can scan. This is the email for contact if you're in the Southampton area. Sometimes I'll have some for you to be able to pick up. The Stony Brook Southampton Hospital Tick Center does see patients several days a week. All of our phone number and contact info is there. You can find me on Instagram where I'm always posting interesting Lyme disease updates that are out there. And we sponsor these talks, we buy these kits. So even a $5 or $6 donation will help us to make more and more and more of these kits. So there's a couple of questions here that I'm going to just plow through very fast. And let's see. Yep. False, false, false. Right. Yes. Sherry, snow is a cozy blanket for ticks. Can I borrow that? I'm going to add that to my next slide set. I like it. So let's see. Right. False. Right. Perfect. Yes, exactly. So great. Laura, number one. Do you recommend starting antibiotics for every tick bite found on someone? No. Number one, if it's a male tick, it's probably not feeding and giving you infection. Number two, if it's a dog tick, less likely of infection. If it's a deer tick, Yes, an engorged female deer tick. I give everybody antibiotic prophylaxis, or even if they've had a deer tick on them and they're not sure it's engorged. Absolutely. Right. Um, and yes, there actually is, Laura, there is a vaccine under study for Lyme disease. It's even being used in patients right now. Um, Now, back in my old office in the late 90s, we were using Lymerix and giving the Lyme disease vaccine, right? But you know what happened? In people with Lyme disease vaccine, they felt invincible. They ended up without using tick spray, without using precautions. People with the Lyme vaccine had a higher rate of babesia, higher rate of Ehrlichia, because they didn't even think about prevention. As we know now, there are so many different variations of Lyme. I'm really not convinced that there can be a vaccine created that covers all the kinds of Lyme and all the co-infections. What I am amazingly excited about is in Texas, there's a company working on a type of vaccine where you take a treatment, and if the tick tries to bite you, it doesn't like it and falls off. That's the revolution that we're waiting for. More of like a tick repellent vaccine than a disease repellent one. So. And let's see, Marissa, if someone's had Lyme for years and years and never treated, absolutely. People, I've had so many patients, especially like in the Latino immigrant community where they're doing landscaping and getting ticks. Like, oh, my husband's had bad knee pain and fatigue, and sometimes he has a numb face. Like for years, I'm like, take doxycycline. You know what I mean? So, got it. Are there natural predators for ticks, right? Are there natural predators for ticks? There are, we talk about possums and turkeys and guinea hens, but there's a lot of mixed data on that. Guinea hens can eat thousands of ticks, but they also carry them around on their belly and spread them, right? So right now it's oil of lemon eucalyptus, Three Moms Organic, permethrin, and all of us in this group who are committed to fighting ticks, right? Yeah, Susan, there used to be take two doxycycline after a deer tick bite. That's one approach. There are different approaches to it. That's a whole nother um, lecture. Great, great, great. Excellent. Yes, fantastic. All right, everybody. If you've got special requests about long-term Lyme or more stuff on prevention, you can email me, or Kara and I can always come back for another encore that way. And again, I know we're a little over our time, but we'll see you at the Quag Wildlife Refuge with all the tick prevention on. Kara, I'll pass it back over to you.
Thank you, Jerry. That was so informative. I always learn like five new things when I come to each of your talks, so thank you.
Fantastic.
Yeah, and I'll just wrap up by saying thank you all for coming to tonight's program. We hope to see you on the trails, and I think a lot of times that all of this knowledge is power, and we like to prevent any illnesses but not get paranoid. So I think, all of the knowledge really helps me feel comfortable out on the trails.
Of course. Yeah,
And
you got to get outside. Absolutely. So,
yeah, so we'll see
mhm.
you all soon. Thank you so much.
Look for the recording. The recording will be up
Yes.
on the YouTube page.
And I'll
So,
email it out to everyone too.
great. See you then.
Thanks, Jerry.
Okay, thanks. Bye.
Bye.